Well, good morning, everyone. For those of you who may not know me, my name is Tracy Allard, and I have the honor of serving as the MLA for Grande Prairie. And it's a tremendous pleasure once again to welcome our Premier to Grande Prairie, to my favorite constituency. And it's always an honor to host our Premier, and I'm so blessed that he makes the effort to come here so regularly. Thank you, and please welcome the Honorable Premier Jason Kenney.
Thank you so much, Tracy, for welcoming us here to beautiful Grande Prairie and for all of your public service. Thank you, Angie, for opening us with that beautiful prayer to our Creator. And if I could just add to that, a prayer for peace for the people of Ukraine today, at a time of great adversity for them. And thank you to all of my colleagues who are joining us here today. I'm thrilled to be visiting this truly Alberta northern city with my colleagues, Health Minister Jason Copping and Infrastructure Minister Prasad Panda, as well as your MLAs, the President of the Treasury Board, Minister of Finance, Travis Tays. After this Thursday, I think he has earned the title Canada's Best Finance Minister. And as I mentioned, MLA Tracy Allard and her great work. It's also wonderful to be joined here today by Chief Ramona Horseman of Horse Lake First Nation, First Nations Elder Roseanne Mustos from Sturgeon Lake, Cree Nation, and Métis Elder Angie Greer, from whom we just heard, as well as Len Auger, who co-chaired the Grande Prairie Regional Hospital Indigenous Engagement Committee and is president of the Grande Prairie Friendship Center. Thanks to all of them for welcoming us here to traditional territories of the Indigenous people and of the Métis people with a special connection to this land. And of course, I must also recognize those here today from AHS, who are Dr. Brian Muir, Northern Director, Stacey Greening, Chief Zone Officer, and all the physicians and surgeons and other staff who are making the hospital their new home away from home. We couldn't do it without you. The last 2 years have showed us this truth in a profound way, and they demonstrate why Alberta's government is making such historic investments in healthcare right now with Alberta's recovery plan. That's our plan to build the key infrastructure, the schools, roads, bridges, and yes, hospitals that Albertans need both today and in the future. In fact, just 3 days ago, I was in Red Deer to announce the largest single infrastructure investment in central Alberta history, the $1.8 billion investment to upgrade the Red Deer Hospital and expand capacity so that we can never again repeat the kind of stress that our system was under at the peaks of COVID. So thank you all for being great partners in Alberta's health system, dedicated to keeping Albertans healthy and happy. Now, before we get to the real business of the day, the exciting official grand opening of this incredible new hospital in Grande Prairie, I want to take a moment to talk about the easing of additional COVID-19 restrictions across the province starting on March the 1st. It seems fitting that we are here at a hospital to talk about COVID, where so many individual battles against that disease have been fought. Time and again, our healthcare system has been stretched to its very limits. Its workers physically and mentally exhausted, our facilities constantly readjusting their spaces to accommodate yet more patients. And they continue to care for Albertans like the dedicated professionals that they are. Fortunately, all signs here and across the world suggest that the worst of COVID-19 is behind us. The pressure on our healthcare system is easing as hospitalizations due to COVID-19 are declining. On February the 8th, when we announced that Alberta was moving to step 1 of our path back to normal, there were 1,615 Albertans in hospital with COVID-19. And I pause to say that that 40% of those were incidental COVID cases as opposed to being treated for COVID. Yesterday, that number of total COVID patients in our hospitals was down to just under 1,300, and that's a 20% decline in just under 3 weeks. We've seen a further reduction in Alberta's intensive care units, where there are currently 88 people with COVID, and that's down about 34% since we started opening on February the 8th. Our 7-day average of total hospitalizations of 1,435 now is down from an average of over 1,600 from February 14th. And the 7-day average for intensive care occupancy has also decreased significantly to 103, down from 126 on February the 14th. So all the numbers are going in a very positive direction. And the best news when it comes to our hospitals is that overall, our rate of new hospitalizations due to COVID-19 has dropped significantly over the last month. In addition to declining numbers in our hospitals, our daily cases, and that's more of a leading indicator, continue to decline quickly. Yesterday, we saw an increase of only 600 cases, and that's down from a peak of 6,800 on January the 11th, so a 90% decline in daily new cases since then. We recognize that due to changes in our PCR testing regime, that the number of active cases isn't now the best metric, but it's still an encouraging sign, especially when we look at the positivity rate. That's the percentage of people getting a PCR test that come out positive. Well, on that, there is a continued downward trend, though there are slight fluctuations, of course, from day to day. So on that metric, our 7-day average PCR testing positivity rate is at 22.9% when it was 29% just 10 days before. Our active case rate continues to fall. The provincial active case rate per 100,000 people, well, it's 240 now, and that's down from 472 last week. In addition, trending data from our wastewater surveillance, and we do that in Grande Prairie and about 17 other communities around the province, and that's an important leading indicator. Well, it shows that transmission is falling or is stable in almost every one of the 18 communities where we do that testing. And when considering all of this information together as a whole, there is no evidence at this point to suggest that our transition to normal is negatively affecting our healthcare system. And in fact, it appears that overall transmission in the province continues to decline, hospitalizations continue to decline, and all of these positive trends continue after schools resumed in classroom learning 6 weeks ago, and 3 weeks after we lifted all restrictions on kids, including masking for kids, and lifted the restriction exemption program on February the 8th. So that's important because we needed to do this carefully and prudently. We didn't want to rush into it. We needed to make sure to take this one step at a time to be sure that our relaxation of these difficult public health measures did not push us back into an uptick in viral transmission or hospitalizations. And now, 3 weeks later, we can say with confidence that the numbers continue to decline rapidly despite those important measures we took 3 weeks ago to open up. So I am very pleased to announce that with these promising trends, we are in a position to safely move to step 2 of our path back to normal and remove the vast majority of remaining public health measures in Alberta. Minister Copping will provide additional details, but beginning on March the 1st, that is to say effective 11:59 p.m. on February 28th, good thing it's not a leap year, we will end the provincial mask mandate through, though masking will still be required in higher risk settings, including public transit, Alberta Health Services operated facilities like this hospital, and continuing care settings, nursing homes across the province. We will also remove all capacity limits for venues. We will end restrictions on interactive activities, on liquor service and operating hours for our bars and restaurants and hospitality venues. We'll remove all social gathering limits. We will lift remaining school requirements, and we'll end health screening before youth activities, which is the only remaining measure applied to children and teenagers. We will also lift the mandatory work from home order, and let me say that's going to be great news for the downtown cores in our 2 big cities as workers come back to their offices. I know there are some of some who greet the lifting of restrictions with some mixed emotions. But I want to remind you, Alberta is not alone in this approach. In fact, places around the world and across Canada have begun their transition to the endemic state and have lifted measures as their Omicron wave subsides. And let me just say about that, we keep a close eye on what's happening right around the world. England, Ireland, Scandinavia, several European countries, South Africa, many U.S. states that got hit by the Omicron wave weeks before Alberta have also lifted restrictions. And so we can see what impact they've had. And the impact is very encouraging. Their numbers and hospitalizations around the world have continued to decline weeks after lifting restrictions. So I think we can move forward with confidence based on not only our experience here, but around the world. What we're seeing in the areas that are a few weeks ahead of us, as I say, including the UK, is that the relaxation of measures is not leading to a rise in new cases and is not overwhelming hospitals. This is good news as we move to lift almost all restrictions in Alberta this week. And I'd like to ask all Albertans to be patient with one another as we transition out of the pandemic mode we've been in for nearly 2 years. There will be some who will choose to wear a mask or who make choices about their activities based on their own personal risk assessment. And we need to respect those choices, the choices that individuals make. I realize it's difficult to shift a point of view and contemplate the future when so much of the past 2 years has taught us uncertainty. But we just cannot continue to live our lives indefinitely with restrictions on our rights and freedoms, on our normal lives, and with all of the negative consequences that those things bring for mental health, for people's financial well-being, for our life together as communities. We are social creatures. We are designed to interact with each other, to see each other's faces, to be community, to be close to one another. And let us embrace that normalcy as we are able to lift these restrictions safely. And indeed, with such high rates of vaccination and more effective new treatments coming on board, we shouldn't have to be concerned. We will be cautious, and we will continue closely to monitor trends in the future. But the path forward will be based on more and more people choosing the safe and effective protection of vaccines, as well as a growing number of treatments that are being approved and will be widely available. So if you are still unvaccinated or not yet fully vaccinated or haven't yet gotten around to your booster shot, I just strongly encourage you to do so, not only to ensure that you stay healthy, but also because it helps us protect our hospitals from potential future waves. And just a little note on that, I know there's a lot of scuttlebutt out there that the vaccines aren't really working. Well, it's true that they're less effective at preventing infection than earlier because they've had a waning effect and this Omicron thing is more transmissible, but they are still incredibly effective at preventing the kind of severe outcomes that land people in hospitals like this one in Grande Prairie. So take a look at the information if you're not there yet, and especially for the folks that got 2 shots, please do come forward when you're comfortable doing so for that extra protection of the booster. Now, let me just say that our budget earlier this week, Travis's budget, was focused on the future, on moving forward, with a particular focus on strengthening Alberta's healthcare system, but also speeding up our economic recovery and just making life better for Albertans in general. We are seizing this moment, and we have to keep moving forward. I believe Albertans are ready, once again, to work together for the good of all of us. This new Grande Prairie Hospital is a fantastic example of what is possible when we work together. And I am so honored to mark the grand official opening of Alberta's newest, most modern, and technologically advanced hospital. The hospital officially opened or practically opened in December, taking over the role as the community's acute care hospital and emergency department from the vital but aging Queen Elizabeth II Hospital. The QE2 has served your city for well over almost 40 years and will continue to be home for those in the Mackenzie Place Continuing Care Facility as well as to provide dialysis and rehab and respiratory services for this community. But Grande Prairie has grown a lot over the past 4 decades, fueled by our energy sector, our oil and gas industry, by agriculture and forestry, and so much more. And its population is expected to continue to grow. And in fact, a big part of Travis's budget is investing in attracting newcomers from across Canada and around the world for the jobs we think we know are being created this year and next. And so you can expect GP to continue to welcome a growing population as communities across the province. Now, you have needed and deserved a new hospital here for a very long time. And this government is delighted to see this day finally come to pass. As Health Minister Jason Copping will explain in more detail, this hospital will allow for thousands more surgeries. It'll provide the best cancer care available, including for the first-time radiation therapy to Northern Alberta residents. The hospital is, and I did get an advanced tour a few months back before it began its functional opening, and it is decked out with the most modern equipment and services available, including the new Connect Care with Provincial Health Information Network. Projects like this are part of Alberta's recovery plan, part of our expansion of capacity. This $870 million hospital will support the health of the community and provide jobs, social and economic vitality in the city and area. So the recovery plan has sparked so much growth here. The Northern Petrochemical Corporation planning to build its $2.5 billion facility in Greenview County, which will create thousands of jobs and further diversify the region's economy. The Strategic Transportation Infrastructure Programs investing $32 million in municipal road, bridge, and community airport projects across the province, including resource road improvements in the county of Grande Prairie. And hello, Reeve, good to see you. We are building Alberta's future with these projects and with a hospital that can grow as this wonderful, young, and just tremendous Alberta city is growing. I say tremendous city because when I think that really Grande Prairie in so many ways reflects the spirit and the heart of Alberta with the work ethic, the youth of this community, the economy based in resources, but also so diversified and leading the way. So this hospital, it means more beds, it means more surgeries, it means smarter healthcare services, all offered in a hospital designed around the needs of families, parents, kids, and neighbors. This is your hospital, fueled by the dedication of nurses, physicians, and other healthcare workers to provide you with the best care that they can possibly give. And Alberta is committed to building a stronger province, a stronger healthcare system, and more vibrant communities that can bravely face future emergencies knowing that we are prepared and resilient. So thank you. Thank you to everyone. Thank you to the construction workers who worked through many cold winter months here in Alberta. Thank you to all of those who helped to plan this project. Thank you especially to Grande Prairie residents for your patience. We know, but good things take a while, and this is a great thing. And so I am thrilled officially to announce the grand opening of the Grande Prairie Hospital. Congratulations.
Well, thank you so much, Premier. It's great to be here, and thank you for your leadership in continuing to support Grande Prairie, the North, the expansion of health services, and particularly in the northern area. I want to thank my colleagues for being here today. It is great to be able to make this announcement. Minister Panda, Minister Taves, MLA Allard. Thank you also to AHS. For inviting us here today, and all the healthcare leaders for making this project a reality. And thank you to all the community leaders, because this truly has been a group effort over a long period of time. And then lastly, I'd like to thank all of the doctors, the nurses, the paramedics, lab technicians, and the host of many other healthcare professionals for being the true heart of this amazing facility. I know it's been a very 2 long years for all of you, But as the Premier mentioned, it is clear that the pressure is easing on our healthcare system. Not only does this allow us to ease more public health measures, it also reduces the stress and strain on our dedicated healthcare workers. From the beginning of our transition, we said we would follow the data carefully, and as the Premier has just explained, we are doing so. That is why we are moving to Step 2 beginning next Tuesday, March 1. This means that all remaining capacity limits and all venues will be lifted and restrictions on hours of operation, liquor service, and interactive activities will end. There will be no limits on social gatherings, regardless of whether they're inside or outside. Mandatory work from home orders will be removed, though some workplaces may choose to maintain this if it makes sense for their operations. Remaining provincial school requirements, such as cohorting and physical distancing, will no longer be required. Health screening for youth and children before they take part in activities will no longer be mandatory. And the provincial order for mandatory masking indoors will be removed. However, as the Premier said, masking will continue to be required in high-risk settings, including AHS facilities, such as the hospital we're in today, continuing care facilities, and public transit. And just as a note, regarding public transit, that will not include a taxi or Uber. Now, although the mask mandate has been removed, continue to expect that when you access healthcare in community healthcare settings, like a physiotherapy clinic, pharmacy, or a family doctor's office, you may be asked to wear a mask. Now, this doesn't mean we don't remain alert and aware. As I've said before, we are proceeding through our transition carefully and prudently, which is why we're maintaining protections for spaces such as continuing care and hospitals. That said, we are confident about our approach. Every day, more and more Albertans are taking steps to get that first, second, third, and even their fourth dose of vaccine. And we are continuing to work to make vaccine accessible across the province, including pediatric vaccine available on a walk-in basis with AHS and at pharmacies across the province starting next week. We encourage all Albertans to get protected for as many doses as they are eligible. We have seen right here in our own province how widespread vaccination can protect people against severe outcomes. As well, those who are not feeling well should stay at home. I would like to remind everyone that isolation for anyone who has COVID-19 symptoms or a positive test result is still mandatory. This measure will not be removed until Step 3. Now, today is an exciting day for Alberta. We are moving beyond the current wave of COVID-19, and while we recognize it's been a very difficult 2-year period, we're moving into an endemic phase, and it's time for all of us to move into an exciting future that lies ahead for our province. And speaking of the road ahead, I am so pleased that everyone in and around Grande Prairie and across northern Alberta now have an excellent access to top quality emergency and cancer care, as well as other vital hospital services, both now and for a long time to come. The Grande Prairie Regional Hospital is remarkable and has been built to meet the needs of patients and families. It has 243 single patient rooms, many with in-room couches that convert into beds for family members. There are family rooms for overnight stays and spacious waiting areas with multiple charging ports to keep people connected. 11 operating rooms will provide thousands more surgeries each year. A new mental health unit has added 10 more beds to the previous 18, including, for the first time, dedicated mental health beds for children and young people. The hospital also contains a state-of-the-art cancer clinic with 2 radiation vaults. This means people from the Grande Prairie area no longer have to drive 4.5 hours to Edmonton for radiation treatment. All told, we've built this hospital ready for the future. The new emergency department can handle up to 120,000 visits each year, double the number previously seen at the QE2. All this equates to the best care in a superb new facility here for Northern Albertans at their most urgent and vulnerable times. Increased surgical access will also be part of it. As COVID-19 cases decrease, we are increasing the number of surgeries being performed across the province. And I'm eager to see more surgeries offered right here in your new hospital, even more than originally planned for, since we've added 2 additional operating rooms as a part of the Alberta Surgical Initiative. This will give you faster access to hip and knee replacements, cataract removal, and other medically necessary surgeries. I am intent on building the capacity of our hospitals and our health system so we can respond nimbly and effectively when we face future COVID-19 waves or any other health crisis. Grande Prairie's new regional hospital is part of this plan, and I'm so pleased to be able to be here with you today to celebrate. So let's continue to take care of each other and meet the future with hope, health, and optimism. Thank you so much again for having me here today, and I now would like to invite Minister Panda to the podium to say a few words.
Thank you, Minister Copping. Good morning, everyone. What an incredible day for residents of Grande Prairie and Northwest Alberta. Our government was committed to getting the construction across the finish line and opening the new hospital. Job done. The construction of Phase 1 and Phase 2 is complete. Workers who gave it their all have moved on to other projects, and now our highly trained health professionals are delivering needed health services and programs to the people of Grande Prairie and area. I want to thank all the health workers for providing that service, much weighted service, quality service for the residents of Northwest Alberta. And I also want to thank my colleagues, MLA Allard, for strongly advocating for this project, and my cabinet colleague, Minister Taves, for funding the project, for providing the additional funds required to complete both Phase 1 and Phase 2 on time. Thank you both. And also, there were many other infrastructure ministers before me who were involved in this project, although I had the honor to take it to the finish line, but many others were involved, both present and former MLAs of this region. I want to thank all of them. While the bricks and mortar for the Grande Prairie Regional Hospital are important, it is the care and expertise that goes on inside these walls that is and will continue to be the most important. Building a modern, efficient, and extremely large modern hospital like the marvel you have here in Grande Prairie is no small feat. A project of this magnitude is vital to support the well-being and continued growth here in Grande Prairie and for Albertans throughout the province. These projects create good-paying jobs, attracts investments into our communities, and supports local businesses, and are an integral part of Alberta's economic recovery. Speaking about Alberta's economic recovery, Alberta Recovery Plan played a very important role last couple of years because our province has invested more than $20 billion for every 3 years we are in power, and going forward for the next 3 years also our capital plan supports $20 more billion, which is a lot of money to invest in both economic and social infrastructure. So our government sees the infrastructure projects in healthcare, schools, roads, and many other important areas as an investment in the long-term future of Albertans, one that increases the quality of life and creates opportunities. Building a hospital of this size and complexity requires hundreds of skilled people who dedicated a good portion of their working life to bring these projects to completion. I would like to take this opportunity to thank the infrastructure team who have collaborated well with the HS and all the tradespeople, contractors, and literally the thousands of people who have worked tirelessly on this project. Again, to all of you, thanks for a job well done. It has been a long haul, and Grande Prairie, for all of you, the residents, the opening of this new medical marvel is the next chapter in your history. You know, you now have Alberta's newest and one of the most innovative hospitals in the province of Alberta, one that will meet the needs of Grande Prairie residents now and well into the future. Thank you all for your patience and perseverance. Thank you.
And now it's my tremendous honor and pleasure to invite my colleague and my friend, as the Premier said, the best finance minister in Canada, I would argue, Minister of Finance, Travis Toews.
Well, thank you, Tracy. This truly is a great day for the region. It's a great day for the Northwest and really for the province as a whole. Premier, thank you for coming up to celebrate this important opening today. I'd like to thank my colleagues, Minister Copping, Minister Panda, and of course always my colleague here in the Grande Prairie region, MLA Allard. You know, one thing, we've come through a tough couple of years, and I reflect on the conversations that I've had over the last couple of years from time to time with local healthcare practitioners, with local doctors and nurses, particularly last fall, as we battled through the fourth wave, the Delta wave, the COVID wave. And the cries and pleas that I heard from ICU nurses, physicians and surgeons that were serving on the front lines in this community during that difficult time. And I want to say thank you. Thank you to you in this region, in this community. Thank you to our incredible doctors and nurses and frontline healthcare workers across the province for your incredible sacrifice. One thing, again, that COVID has taught us is that we have very little marginal capacity, healthcare capacity in this province. And that's why in Budget 2022, and in fact, even in the previous budget, over the past 2 years, we've added $1.5 billion to healthcare's base budget. Those funds will be targeted to enhance capacity across the province. And this announcement today is a part of that capacity increase. With the Grande Prairie Regional Hospital and the additional capacity and the additional services that are offered, we know that many residents in the Northwest who may have otherwise gone to Edmonton and Calgary for perhaps cancer care will be able to receive that care right here in this region. And for that, we're very thankful. We also know that this is a growing region, and there will be great demands on our healthcare system in the future, and we believe that this hospital will position us to deliver first world healthcare, first-rate healthcare in the region, to the people of Grande Prairie, to the people in the Grande Prairie region, but to the people of the whole Northwest of this province and beyond. You know, just as we were recently announcing, in fact, a few days ago, announcing a big investment in Red Deer in central Alberta, a $1.8 billion effectively new hospital build, although it will be a renovation, but it will ultimately result in a new hospital for that region. As we were announcing that project, it just reminds me of those that went before us here and previous governments that announced this new project approximately 10 years ago. And so I just wanted to pay tribute to those leaders that made that announcement. I want to thank our community leaders. I want to thank our AHS leaders, Stacey Greening, Dr. Brian Muir, for your work at transitioning from the QE2 to this new hospital. I can only imagine the challenge of logistics in getting patients over here and all of your services over here and doing it seamlessly. As an MLA, I did not hear any complaints. And so that's a tribute. That is a tribute to your leadership and your effectiveness. I would like to acknowledge and thank our Indigenous leaders, community leaders, Indigenous leaders of our Indigenous communities in this region for your presence today, but also for your advocacy for your nations and for healthcare in this region. Thank you for that. I want to just acknowledge our municipal leaders. We have Mayor Clayton and Reid Beaupre here today. I thank you for your advocacy for this hospital. I want to thank previous municipal leaders as well, because this has been a long road to get to this date. And I certainly want to thank our previous MLAs who were real advocates for this hospital. I think of MLA Everett McDonald, and I think of MLA Wayne Drysdale, who advocated tirelessly on behalf of the residents of this region for this hospital. So today, I think, as Minister Panda noted, we have the privilege of being here on opening day when we celebrate its opening, but there has been so many that have gone before us that have laid the foundation for this great build, and to all of you, I say thank you. So again, it gives me, I consider it a great privilege to be here on this opening. This facility will be very meaningful for residents of the region, and I'd like to thank you all for your attendance today.
And it's like Travis and I compared notes because he took a lot of what I was going to say, but that's amazing. I also want to echo and thank all of those involved with this project. As I look around this room, I see leaders, I see wisdom, I see vision, and it's such a monumental day to see all of that come together in a new facility that will serve generations to come. So I actually wanted to point out one little dignitary that we didn't talk about earlier, and that is, I hope I get this right, little Ezekiel Axel. Little Ezekiel Axel is not quite 3 months old, and he has the honor of being the first baby born in this new facility. So we are so delighted to have little Ezekiel and his mom Mary with us here today. And he waited 2 extra weeks to be born so he could be the first one, to his mom's chagrin. So thank you for bringing him here today to join us. And it was a delight to meet little Ezekiel today because it makes me think of the generations to come that will be served by the vision of those who came before us. So thank you to everyone for joining us here today. It's now my honor and privilege to introduce a friend and a colleague, Her Worship, the Mayor of Grande Prairie, Mayor Jackie Clayton.
Thank you, MLA Allard, Premier, Ministers. Thank you all for being here today and joining us on this momentous occasion. I'd like to first start by acknowledging the homeland of the many diverse First Nation and Métis people who have walked on this land since time immemorial. We are grateful to work, live, and learn on the traditional territory of Treaty 8. Opening the Grande Prairie Regional Hospital is a transformative moment, not only for the city, but for the region and the province. Since the doors first opened in December, the facility has already begun to provide health care, significant health care for our region, with being Alberta's fifth cancer clinic and the only facility of its type north of Edmonton. We know that patient care is of the utmost priority in this region, with many modernizations, including one that myself and Reeve Beaupre would have heard about many times, improved parking for patients and visitors. At the city, we're very proud to also invest in 2021 in the construction of the Masque Park pedestrian pathway. If you haven't seen it, it's outside our doors, and it's truly a bridge that connects the park to the new hospital and the grounds that surround it for the patients to enjoy an experience and a relaxing surrounding in the green space during their stay. We're also encouraged by the continued recruitment of healthcare professionals so that all disciplines can enjoy this infrastructure and move to our region and to serve our continuing growing population. The hospital's partnership with the Northwestern Polytechnic is a major part of this effort. It provides an educational area right here on site in the new hospital to be used for education and the nurses and others. This partnership, as well as the regional support of those like the County of Grande Prairie and Reeve Beaupre, are significant, and through the collaboration and the cooperation to make this facility a success. I also want to thank everyone's hard work who made this day possible. The many trades, as noted in the construction, our government advocates, the healthcare workers who in the middle of a pandemic and the administration opened this facility and brought it to life. Of particular note, we want to recognize the Grande Prairie Regional Hospital Foundation and the Key to Care campaign, many other generous businesses and residents who donated to this cause. Because of your commitment and your generosity, the community is better supported to continue to provide a high level of care and increase positive outcomes for patients and offer services that locally would not have been typically provided other than a large urban center. Lastly, I want to thank the province and the recent investments in the healthcare budget announced for 2022. This will make a real and tangible impact in the lives of our residents. So on behalf of Council and the City of Grande Prairie, the region of Grande Prairie, I want to thank you all for joining us today and sharing in this significant celebration. With that, I'd like to introduce the Chief Health Zone Officer, Stacey Greening, who I must say, through the pandemic, has been a great ally of municipal government. She has answered the phone, she has answered emails, she's come to council meetings when we've asked for it, and she really has been a solid person that we can call anytime, and I truly thank her for her support.
Thank you, Mayor Clayton, and all the dignitaries here today. I'd like to echo Mayor Clayton's remarks, acknowledging that this hospital is built on Treaty 8 territory. Treaty 8 is the ancestral home of many diverse First Nations people, the homeland of the Métis people, and we also acknowledge our Inuit people. We respect the treaties that were made on these territories. We acknowledge the harms of the past, and we dedicate ourselves to moving forward in a spirit of reconciliation with all of our Indigenous communities. You'll hear some of the steps we've taken to make this hospital welcoming from Len Auger a little bit later today. In my previous role as a senior operating officer for Grande Prairie, I had the unique privilege of overseeing the move from the former QE2 hospital to the new Grande Prairie Regional Hospital. Since receiving the keys to the building in the summer of 2020, right up until opening, our operational planning and commissioning teams were busy at the site, ordering and installing equipment, furniture, preparing and calibrating instruments, testing the various building systems and medical systems, mapping clinical workflows, and a full deep clean to ensure it was safe and ready before we began using it to treat our patients or welcoming new patients like little baby Ezekiel. The hospital planning and the move from QE2 to Gprh were supported by a stellar team, and I'd like to give special thanks to both Diana Gitzel and Candace Eady, who led this team with strength, grace, and often a sense of humor, a necessary sense of humor. I truly appreciate both these women's support and dedication through all phases of planning and opening of the Gprh. I'd also like to acknowledge Dr. Joan Lipsicle, who's here today, the former Senior Operating Officer for Grande Prairie, who is part of the visioning and hopes for this hospital and what it could be for this community. All this activity, and yet it wasn't until Move Day on December 4th that the site truly transformed into a living, breathing healthcare facility. Once our patients began coming through the doors, being treated by our dedicated healthcare providers, that's when we really became a real hospital. Another highlight of this facility is the artwork you'll see. And so we ran a photo contest. We received 1,300 photo submissions, and over 60 of those photos were chosen to be put up on walls throughout the facility. And many of these photographers are local talent. So you will see throughout the facility images of the Peace region and celebrating the unique images that we have here. This brings a sense of calm and familiarity to area residents and staff at the hospital. This facility truly does belong to residents of the entire region. I'd like to thank all of the government of Alberta and our community partners, and specifically our Hospital Foundation, for making this new facility a reality. We are genuinely grateful. I'd now like to turn it over to my dyad partner, Dr. Brian Muir, to say a few words.
Good afternoon, everyone. I'm happy to be here today to celebrate the opening of this wonderful new hospital. This is a state-of-the-art facility, and it's been well worth the wait. Grande Prairie Regional Hospital has become a fixture in the community long before we began caring for patients here. People from this region helped create this building. Their contributions throughout the design and construction process, in addition to the many sponsorships and donations through health foundations in the region. These have shaped the regional landscape, creating a welcoming space where we can care for area residents in the years to come. We are grateful for all your hard work. Our physicians and care teams have been making good use of this new facility since day one. Since opening the doors in early December, there have been more than 10,000 emergency room visits, 1,154 surgeries, and 316 babies have been born here already. Shifting care from one facility to another is no simple task. Thanks to extensive planning, cooperation from the various teams and partners involved, and a good hint of good luck, the move from the former QE2 hospital site went smoothly, and it went as smoothly as possible. Physicians and staff provided care simultaneously in both facilities, while EMS crews safely cared for and transported patients across town through the snow. Grande Prairie Regional Hospital brings new and expanded healthcare services closer to home for our area residents. We have two Our cancer center has 2 radiation vaults. This makes our cancer site the 5th in the province, and it's the first in North Zone to offer radiation therapy. Surgical capacity in Grande Prairie will double, with the facility's 11 operating rooms, including 1 dedicated to maternities, and 2 of these supported by the Alberta Surgical Initiative. We have expanded mental health services, especially for children and youth. We have an education area in partnership with Northwestern Polytechnic. This is formerly known as the Grande Prairie Regional College. We look forward to working with our educational partners through the training of our future healthcare teams. And of course, there's plenty of parking available now. The new hospital has been built with the future needs of the region in mind. We will be able to expand healthcare services and our workforce as demands in the region change. There is plenty of room to grow here at the GPRH. This world-class facility will become a beacon to attract and retain both Canadian and internationally trained physicians and specialists. It's not every day that we get to open a brand new hospital, and doing so in the midst of a global pandemic is certainly a first for Alberta Health Services. We are incredibly grateful for the dedication of our healthcare teams. The past 2 years have been challenging for everyone. It has been a welcome change to have something non-COVID that we can focus on and to celebrate. Countless lives will be touched within these walls in the months and years to come. We are honored to be part of their experience, offering care to patients and loved ones throughout their healthcare journey. We are very proud to be able to share this state-of-the-art building with the physicians, staff, volunteers, and especially all of the residents of the Grande Prairie and Northwestern Alberta region. This is your new hospital. Thank you. And now I'd like to introduce Len Auger, who's president of the Grande Prairie Friendship Center and co-chair of the GPRH Indigenous Engagement Committee.
Good afternoon, everyone. My name is Len Auger. I am the president of the Grande Prairie Friendship Center, but more work with Stacey Greening and our Indigenous committee here at the hospital. So hello to everyone that is here today to help celebrate the grand opening of the Grande Prairie Regional Hospital. As the co-chair of our Indigenous Engagement Committee, along with Stacey Greening, the senior operating officer at the time, and because she did such a good job, she got promoted and moved up in a way. I had to say that. Also, I would like to acknowledge and welcome our Premier, Jason Kenney, and all the other provincial delegates or dignitaries, and of course, all our local VIPs. And everybody in this room is a very important person to what goes on at this meeting and in the future of our hospital. So thank you to all present to celebrate the opening of this beautiful facility. We have been working with our local Indigenous stakeholders. And when I say our Indigenous stakeholders, I'm talking about many of our communities in Northern Alberta, Treaty 8. When we initially started the Indigenous Engagement Committee, we had representation from, I believe, 32 organizations. Right, Shannon? And our committee has slowly declined. A lot of the work has been done, but we do have a dedicated group that is continuing to work on indigenizing our hospital. So a lot of work in the Alberta North Zone to help ensure the new hospital is a culturally safe and welcoming space for our Indigenous people. So our objectives are to make this a friendly, welcoming environment for any of our Indigenous people that arrive here for help, for medical attention. And what we mean by that is we want people to feel safe. They want an environment where they're respected, where they're treated with dignity, and they get the best health care. That's what we're looking for as an Indigenous committee. The GPRH Indigenous Engagement Committee brings a diverse set of perspectives from throughout the region to help guide how attributes of Indigenous people and land can be represented at our new facility here. So you can see that we have talked many different aspects of culture. We have talked about many different aspects of inclusivity. We also talked about this hospital looking for and hiring more and more Indigenous health workers. That is some of our goals, and I believe that is actually taking place. Our committee has been involved in ensuring that many aspects and attributes of Indigenous culture and ceremony are included in the day-to-day functions of this hospital. And just so you're aware, as part of one of the activities that our committee did, including Stacy and Candace, leadership group, we actually had a pipe ceremony in this room, I believe it was. And our leadership group was here from the hospital, and we did the pipe ceremony. And it was to bless this place to be a healthy, respectful environment. And so that did happen. And I think we did it inside here because it was quite cold outside at the time. All right. So in here, this includes displays in the main area by two of our Indigenous artists. And some of you may have heard of a gentleman named Lance Cardinal and also another gentleman named Walter White. They do make a lot of Indigenous crafts and artifacts and paintings, and so down the road we may see more of what they do. So we still have some work to do. Our plans to have an Indigenous courtyard is in the works. So some of you who may tour this area, you see there's 3 courtyards. One of them is already designated for an Indigenous courtyard, and also a garden where traditional medicines can be grown along the walls where the garden will be. We do have a teepee that'll be set up sometime in the spring, hopefully. We do have a Red River cart, life-size, a real one, that we got from a gentleman, a Métis gentleman from Drayton Valley area, made us a Red River cart. That'll be displayed out there. And we still need to make or find somebody to make an Inukshuk. So we have the representation of First Nation, Métis, and Inuit. And that'll be the courtyard, in the courtyard. So, a garden with traditional medicines is one of our other objectives. We are grateful for the feedback we have received, and we have received feedback from most people, both Stacy and her group, her leadership group, the maintenance people that have helped us so far in what we're doing. We have also received a lot of feedback from our own people as to what we should be having here. And bottom line, we still want to say a safe and welcoming environment. And that should apply to anybody and everybody that comes to this hospital. So thank you to everyone that is here today to help celebrate the opening with us. In closing, I would like to thank Stacy Greening for her leadership. I've never seen a person of this leadership role with that level of commitment. Her values towards our Indigenous people were very high. She cares. And so with that kind of leadership, it was easy to work with her. Her dedication and commitment, she has provided us working towards building a safe and welcoming environment. And thank you to all the committee members that have worked so hard to go where we're at today and where we want to be down the road. So like I said, there is still some work. And there is some other people I'd like to thank, and one of them is Candace and her group of people that have been involved in our meetings. Last but not least, thank you to the healthcare workers that are here, that work in this hospital. And I can only hope that down the road that our Indigenous workers' numbers go up, that we can recruit and retain more Indigenous healthcare workers in this Grande Prairie Hospital. And I know Shannon and her department have been strongly looking at that. We do have more Indigenous liaison workers than we had at QE2. That, to me, is a positive. All right, so down the road, we're also talking about we may need some more translators. Not everybody talks Cree. And we do have Cree elders that come to this hospital, Dene. And we may need translators. So those are all things that we have a 5-page list of would likes. How's that? Only 5 pages. And we will need some money. All right, well, hopefully you guys are still in government. I had to say that. All right, so in closing, like I said, thank you, and we do have a lot of work, and I know Stacy's moving on, and whoever replaces her, I hope has the same level of commitment, and I would be looking forward to whoever it is. But also, before I leave, I'd like to introduce two folks. A young lady named Ramona Horseman. She is the chief of Horse Lake. And I do have a speech here for her, I think. She is a daughter, a mother, a grandmother, friend of many, advocate of children and the progression of First Nations people, education, health training, teachings of our culture, and many hopes and dreams to come true for us all. So if Ramona, if you want to come up, please. Also, we have another gentleman, if he'll join us up here, and they're both going to do a little speech. And Ramona's going to put her headdress on. And also, the other person I have that's here is a gentleman named Isaac Labucan Avrion. He is the Woodlands Cree chief from Cadott Lake. He's also the Grand Chief of the KTC Tribal Council, Kataskanaw it's called, and he's also the Grand Chief for Economic Development for Treaty 8. So if both of you want to join me up here and have a turn at a speech. Thank you.
Good afternoon. First and foremost, it's always a great way to start off anything as an acknowledgement to the Great Spirit, the Creator, and whatever deity that you believe and you pray to, and how you see it, that it's fitting. Oops. Somebody, my alarm went off in my house. So what I'd like to talk about is, some of the traditions for First Nations people and culturally, like where I'm from, and how fitting that the hospital opens in the year of the bear, Masque. The color of the bear for our people is the color orange. How fitting that is, as well as Indian residential school survivors have been, faced with some of the atrocities from the discovery of the bodies of the children. So I want to make that talk about that it's never forgotten, that's actually something that's really heartfelt for our people and a part of healing, which is health at the end of the day. So the foundation of a good life in the world is health at the end of the day. And health does encompass a lot of different things. It's like your mind, your heart, the air you breathe, the environment around us. So those are really significant to being healthy individuals, being healthy people, regardless of what part of the world you come from. And, Turtle Island is what we shared with the people when they did come here to this land. So I'd like to say that this could be argued by a number of chiefs in Treaty Number 8 territory, but I always say that this is the heart of Treaty Number 8, but I'm sure Chief Isaac believes that he's in the heart of Treaty Number 8 too, right, where his nation is from. But with that being said, we've always invited residents to be around us to share, because that is exactly what First Nations people were here for, is to share with the people who have immigrated here into Canada and Turtle Island. I wanted to say, Horse Lake First Nation, this again is in our backyard, and to hear, the aspirations of the team, that they only have 5 pages, we should maybe add to your pages. I'm not sure we could come up with something while everybody's in the room. So with that, I would like to thank all the people who have made this happen, because we've been, drive past the bridge all the time wondering when the hospital was going to open, and then again, it does take teamwork. And even with that, teamwork does involve ensuring that a lot of the people here in Treaty Number 8 territory are looked after. All the First Nations people are looked after. We all hear the stories of everything's gone on, and it's a true reflection of what Len was saying about health and how important it is to us. How do we keep Mother Earth healthy? We have to do that all collectively, which means that every single person, mind, body, soul, we all have to stay positive, work collectively, unitedly. But I'd like to thank the Premier. Thank you for coming to Treaty Number 8 territory. It's a pleasure to have you here. And to the finance, to finance and infrastructure, to the Mayor, and to Tracy, and your Health Minister. There's so many new names, right? But I'd like to thank everybody for coming here. The Métis Nations, it was nice to hear that somebody made reference to the Inuit. Together we collectively, can make things work and make things happen. But thank you very much, and enjoy the rest of the day, and safe journeys to wherever it is you may be going today. But thank you, and I'm going to hand it over to my colleague.
Well, it's always a pleasure, and it's always hard to follow up after Chief Ramona. She's full of wisdom and good energy, so thank you, Chief. And thank you, and welcome to Treaty 8 territory. It's an awesome to have that acknowledgement here. And this is the heart of the Treaty 8 area, as we are northern, and we stretch out into BC, Saskatchewan, Northwest Territories. And to understand, it was awesome to be at the budgeting meeting just the other day, and to understand that as we are a resource developing country and province, that the resources do come from the Treaty 8 territory, and where we do want to share in the prosperity and the well-being of all our people. So it's an honor to be here. It's an honor to know that I was sitting beside one of the first babies born here, and it's going to be awesome to know that there's going to be way more babies to be born and a whole lot more life to be given and hopefully saved at this hospital. One of the most precious things we have in life is time. It's not money in the bank, it's not the clothes on your back, it's the time you get to spend with your loved ones, your families, your friends, and especially in this time of uncertainty, the time of war across the oceans, and the time of COVID, so it's a real honor to be in this structure that is to provide health and care for future generations. So I know I came to this place last minute. As soon as I found out Chief Ramona was coming, I was like, okay, I'll be there. I didn't know I was going to say any words. I was just going to, she said, bring your headdress. So anyways, it's a pleasure. It's an honor, Premier, Ministers, and I look forward to working with you guys in the future to bring our people to coexist and to work together to be prosperity together. With that, accept.
So we are just about at the end of our program. I just wanted to say a blessing as the MLA for Grande Prairie. I just wanted to bless this hospital. May these doors always be welcoming to those who enter. May these halls and chambers always be healing to those who are here. And may the staff always feel a sense of wisdom, knowledge, and empowerment as they work to save lives and to serve our communities. So thank you all. And last, but certainly not least, we have Roseanne Mustis, the First Nations elder from Sturgeon Lake Cree Nation, to close us with a final prayer. Roseanne.
I'm just going to provide a bit of an introduction for Roseanne. She is a well-respected elder from Sturgeon Lake Cree Nation. Roseanne is a mother and grandmother and is most proud of her degree in social work that she received at the young age of 59. She is currently supporting Alberta Health Services North Zone as the Indigenous cultural helper, working at with our most vulnerable here in Grande Prairie. We are honored to have Roseanne to help us close our ceremony in a positive way.
Thank you.
Well, finally, I'd like to thank everyone for coming today, and thank you, Roseanne, for that beautiful prayer. I'm now going to turn it over to the press secretary for the Premier for the media availability. Justin?
Thank you, MLA Allard. We're going to start on the floor here. Please identify your outlet and who you'd like to direct your question to, and then we'll go to the phones. So go ahead.
Hi there, Shane Clausing with Everything GP News. This question's for the Premier. New hospital's open now, and I'm sure I speak for everyone here. Everyone's probably very relieved the doors are finally open. Yeah. I guess now the biggest question is in terms of staffing and getting this hospital up to staffing capacity. What plans does the province have to get more people to rural areas and work in these rural healthcare settings?
Thank you for the great question. Before answering, I just wanted to also acknowledge, is it Ezekiel? What a great name. That's an awesome name. Well, for the first baby born here, what a beautiful thing. Congratulations. And 600 and some, you guys are having a lot of babies up here. This is fantastic. By the way, another one of the healthcare projects we're doing, and I was pushing on an open door with Travis, was a new birthing clinic up in Lacrete, because they're having about 400 babies a year on that little population. So we love to see, that's northern Alberta. That's where you guys have a strong future. I also wanted to thank Roseanne, Thunder Spirit Sweetgrass Woman, for your beautiful closing prayer and the wisdom that you've brought us. I want to thank as well Len for all the work you've done, and to thank my friends Chief Ramona, Chief Isaac, for their leadership and for welcoming us to Treaty 8 territory. These are both fantastic Indigenous leaders, so focused on prosperity and a bright future for their people, and we're privileged to be partners with you in that. So on your question, I wanted to say, look, in this budget on Thursday that we tabled, $600 million additional in the base budget for Alberta Health Services, Alberta Health. The focus is to increase capacity, and that means partly recruiting, training, and hiring additional staff. In fact, part of this is about the Alberta Work Initiative, where we're investing money in a targeted way in our post-secondary institutions for in-demand occupations, and one of the key occupations will be nurses. In addition, we have outlined special incentives for both nurses and physicians for rural recruitment and retention. And when we say rural, we mean, I think, basically outside of Calgary and Edmonton. That includes Grande Prairie, it includes this hospital. We have put out $90 million new dollars per year, guaranteed in this budget, for rural physician recruitment and retention. And just to put that in context, there are only about 900 physicians serving outside the two big cities, so that's about $100,000 per position. That's a strong incentive. We've also, and Minister Toews, who is responsible for collective bargaining with our public sector unions, it's not very often that a government offers something proactively in a negotiation, but in the negotiations with the Union of Nurses, he actually proactively offered on the table I think a $5 million incentive for recruitment and retention of nurses in areas that need those additional services. So the overall $600 million will help to increase capacity. Generally, that does mean staff. There's the dedicated focus on rural, including mid-sized cities like Grande Prairie. Did you want to add anything, or did I think I might be missing something, Travis? Come on in.
No, Premier, I think you've really covered it. We are in the collective bargaining agreement, and by the way, I was very grateful that we could come to an agreement with UNA, an agreement that effectively ensures that Alberta has the highest paid nurses in the country, and yet also an agreement that respects our fiscal realities in this province. But as the Premier pointed out, included in the agreement is effectively relocation and retention incentives of $5 million for rural medical facilities such as this one and other regions such as this, but also a $2.5 million relocation assistance package as well. So we recognize that, sometimes it's hard to get professionals outside of Edmonton and Calgary. For those of us that were born and raised here, we just can't figure out why they don't all race and beat the door down to get out to Grande Prairie or Beaver Lodge or High Prairie, wherever it is. but sometimes you have to incentivize folks to get out here. So a very good question around professional retention, attraction. The one thing I'll add yet, Premier, is that in this budget, we have a real focus on labor, talent, and skills. And so Minister Copping is working with the Minister of Labor, Minister of Jobs, Economy, and Innovation, and also our Minister of Advanced Education, identifying occupations where effectively we're short, where we're short of healthcare workers, where we're short of other professionals, where we're short of truck drivers and other occupations. And so there will be targeted funding with our post-secondary institutions to expand capacity. All of that should work together to ensure that we can better staff this hospital and other healthcare facilities across the province.
Thanks, Travis, and thanks, Premier. And just wanted to add one more comment to that, because this issue in terms of staffing is a real issue, and it's not only here. It's been an issue in Alberta, particularly rural Alberta, for a while. But it's not only an issue in Alberta; it's across the country in most rural areas. And one other element that we're actually looking at in terms of being able to address this, and AHS is driving this in terms of sponsors of professionals, particularly foreign-trained doctors. And we announced 2 weeks ago the Premier's Alberta Advantage Immigration Strategy with a new rural renewal stream. That stream is going to focus on professions where there are shortages, and one of those key areas again is healthcare professionals. So we're going to leverage that, and quite frankly, I've already put the challenge to the colleges, and we've done this as a government with the Fairness for Newcomers Act, and then also we passed the Labour Mobility Act to be able to not only bring welcome people from around the world, but people in other provinces so they can come in and be more easily certified. But also the challenge to all of the health professional colleges is how do we reduce this process? Because we know we need the people, we need them now, and we need to use every lever. And I can tell you, my ministry, our government, you can see in the budget and the Premier's focus is working with healthcare professionals, and the great work of AHS is get people here so we can provide the services that Albertans need.
Shane, do you have a follow-up?
I do, yes. This is for the Premier. Obviously, the other big news today is heading into step 2 for March 1st. I just want to ask you, Premier, a lot of people March 1st are going to say, you know what, COVID's over, kind of. It's masks are off, and I get to go party, I get to go do whatever. If another wave does spike up, how confident are you that if you guys have to re-implement restrictions that people are actually going to listen this time and I guess go back to living what the last 2 years have been like?
Well, that's a very good question. And first of all, you know what? People should be happy that we are able to lift restrictions and get life back to normal. They should also be mindful that COVID continues to be a reality, and everybody's going to have to figure out their own risk level. There are immunocompromised people who may want to take extra care if they're in large crowds, for example, and things like that. So we're going to respect, increasingly we have to shift to moving the responsibility from the entire society to a much more focused approach based on personal responsibility. And that's not just in Alberta, that's all around the world, because we just cannot continue on like we have for the past 2 years indefinitely. We're going to break society if we keep doing that. Like, it just cannot continue on indefinitely. So that's point one. Point two, it's up to us, and let me say, AHS, to increase capacity so we don't have to resort to the damaging and blunt instrument of restrictions on our lives and on our freedoms in order to deal with the problem of limited capacity. And let me speak bluntly. When we came to office in 2019, according to the Canadian Institute of Health Information, Alberta had the lowest per capita number of ICU beds in Canada, even with the second most expensive healthcare system in the country. So this is why we put $1.5 billion additional dollars into health, and we are focused obsessively with increasing that capacity so we have the space in our healthcare system so we don't have to go back to the last 2 years. Thirdly, I believe that we have 90% of our adult population with the first dose on vaccines, 86% second dose. We do need to see those third doses come up. That's our one area of concern. We need to see that third dose number come up to protect us from future waves as a population. But we have much wider population level protection from COVID than we've ever had. We're ahead of most of the world in population protection. More effective treatments and therapies are coming on board and getting developed by scientists, approved by regulators. That's going to be a big help as well. We will keep an eye on this. We've always said we will not allow our hospitals to be overwhelmed. But I am confident that we can avoid ever having to return to damaging restrictions as long as we continue to see people step up, especially on those third shots, and we learn to live. We learn to live with COVID. We're increase health capacity, keep getting those third shot numbers up, see those new therapies come on board, take care on an individual basis, and I think we can move forward, getting our lives back to normal.
Hi, Jesse Boyley with Town and Country News. With like the lower uptake in vaccinations, especially in an area like Grande Prairie, can we expect to see some sort of targeted campaigns to our area to, promote more vaccinations?
That's a very good question. So here's the good news. We did have targeted campaigns when we saw much lower levels of vaccination in regions of the province, like much of the Northwest. And people responded. They answered the call. I mean, I think that in August, in the summer, there were many of the areas in the Northwest that were well below 50% first dose vaccination for adults. And now they are all above 50%. I think in much of this part of the province, we're at like 80% first dose coverage or better. So I want to thank the local leadership, everybody in the health system, First Nations and others for working with us in that targeted outreach effort to convey the safety and effectiveness of the vaccines. We have seen a real turnaround. Now, there are still some areas that are quite low, and that is a concern on a localized basis. But on a province-wide basis, we are in a much better position. We went from 76% first dose coverage amongst adults in August to 90% now. We went from 68% second dose coverage province-wide amongst adults in August to 87, approaching 87% now. So it's definitely gone in the right direction. I think a lot of the thing that does concern me, like England that's opened up completely, has done so with 80% of the adult population having had the third shot. So they're in a better spot, frankly, than Alberta. We are below Canada on that third shot. I think one of the reasons is a lot of folks who got Omicron infections, mild cold-like symptoms, they're saying, oh, well, we'll wait 3 or 4 or 5 months before we come in and get that. So we'll see we'll monitor that closely. Just encourage people, because the best way that we can together ensure that we stay open is that protection.
Go ahead. All right, and my second question, I guess, would be just on physician retention in the area. Just this week, west of us, we saw in Beaver Lodge had no doctor for 24 hours in their hospital. North, just our neighbors north of us in the clinic, have had no doctor almost all month in Sexsmith. What are some steps that are being made currently to make sure that our area, and especially this hospital, is after physicians?
Thank you. And that comes back to the first question. As I say, we put 90, first of all, we have more physicians and more nurses working in Alberta's health system now than ever before in our history. Over 10,000 physicians are billing Alberta Health actively right now. And so we have seen an increase overall. Now, there's always been, as you know, a challenge in smaller rural communities at recruitment and retention. We were able very effectively over much of the past 25 years to use immigration as a tool to address that. All those South African doctors and many other African doctors who came in, because their immigration status was, in a sense, tied to them being able to come and practice. So COVID has turned off that tap because of international travel restrictions. When international travel returns, you're going to see hundreds of thousands of selected immigrants moving to Canada, and a lot of them will be doctors. And I believe local hospital committees, foundations, and working with AHS, will be recruiting those folks with these incentives we put in the budget, $90 million for rural physician recruitment and retention, to land them in places like Sexsmith and Beaver Lodge. So that's a key part of the strategy, as Minister Copping said, leveraging the immigration. Another is knocking down the barrier to certification of physicians and nurses coming from other provinces. We've done that with the Labour Mobility Act. It tells the regulators of the professions, like the College of Physicians, they've only got 2 weeks. It's a deadline in law now to certify a doctor from BC or Nova Scotia who might come out here. But the incentive, look, we're offering better pay than any province to the docs, stronger rural incentives, and, oh, by the way, lower taxes, and a great quality of living. But I can tell you, reporters from Newfoundland to British Columbia and rural regions write the same stories, and they face the same problems. It's not unique to Alberta. Anything to add on that? Okay. Thank you.
Thank you. Erica Fisher, Today FM.
Good to see you again.
Thank you. Nice to see you.
Did you interview me in 2016?
Many, many times.
Okay.
You started your campaign here. How
First
could
time
we
I
not?
met you was outside that barn at about 6 p.m. on July 6 of 2016.
That's what started it all, didn't it? No? Well, I would love to ask you this question, but I'd also love to post it to Minister Panda as well. Given the length of construction and the budget being both much higher than were initially intended, what lessons can we take away from this project to future infrastructure and similar sized projects?
That is a billion-dollar question. You know, this is a celebratory day, and we're going to cut a ribbon somewhere here, aren't we, in a minute? All right. But it's been a long time getting here. We all know that. And this community's been so patient, and there were a lot of mistakes. My understanding is the main mistake was not locking down the plan, but constant changes. And every time in a complex project like this, there are new demands and modifications. That means delays and delays and delays and higher costs. And so Minister Penn has been working with his team at Infrastructure and with Health for future projects like this big Red Deer expansion to get the planning done really tight at the beginning. And then when somebody comes along with a bright idea 18 months later and say, well, we need this new thing, we say, sorry, too late, we're moving forward. Prasad, that's a layman's understanding of this. Give us the engineer's view.
Thank you for that important question. Folks at Alberta Infrastructure realize that we should get the best value for taxpayers' money. So going forward, what we are trying to do is to make sure the scope of the project is well defined before moving into construction. So there will be perfect coordination with Alberta Health and Alberta Health Services and other stakeholders, local community like the health foundations. So we're going to go through a gated process, which is, some of you may be familiar, in any major industrial project, they go through a gated process. So you don't go to the next stage unless you tick off those milestones. So in this case, for any big major health projects, I mean, schools are not as complex as health projects. So we have a needs assessment done, and then we have clinical services plan developed, and then we have functional programming, and then business case has to be approved. So we had to jump those hoops before getting into the final design and engineering and procurement and construction stage. That's one thing we're going to make sure before we get into construction, we tighten all those loose ends and then go into the construction. And going forward also, one thing I observed with this particular project, which Premier was right, we don't want to repeat that with other major projects like Grande Prairie, like Red Deer. That's why we're going to take time, put enough resources into front-end planning and design. So, and also the contracting documents, we are just making sure they respond to the scopes. If we had to issue the work orders, to eliminate the frequent change orders, we are going to build that contracts in a way that responds to the immediate needs, de-risking taxpayer investments. So those are a few things we are working on. There is always scope for improvement, but as Premier noted, today is the day to celebrate here. What a great day for Northwest Alberta. Thank you.
Thank you, Premier. Mac Vincent from mygrandeprairienow.com. I just wanted to ask you, first of all, congratulations on this announcement as well as the Red Deer expansion. What other work is being done in those smaller Alberta communities to provide some of these newer or expanded facilities for residents?
Very good question. So I mentioned Lacrete with its burgeoning population. We included in the budget $45 million? Yeah, additional. So now over $70 million for I'll be honest. We started this as a maternity and obstetrics clinic up there, and it's now grown. The scope of it has grown, and there will be many additional services provided up there in Lacrete, and that's a great project. In this budget, a lot of other capital projects, including the Brain Institute at University of Alberta. Yesterday we were at the Foothills in Calgary, and of course those serve rural Albertans too, the big project in Red Deer. But there's a lot of smaller projects to upgrade, expand, modernize equipment at these rural hospitals. We have over 100 hospitals in Alberta, and about 70 of them are fairly small rural hospitals. And many of them have not had significant upgrades or improvements. So through our capital maintenance and repair budget, between Prasad's department and Minister Copping's department, there has been tens of millions of dollars invested in things like, for example, over in Slave Lake, we're putting in a new EMS operations center because they haven't had adequate support. High Prairie, just this past week, they opened their new dialysis unit there. So lots of little projects in those hospitals. Jason, could you probably are more familiar with individual projects.
Well, the only other, thanks, Premier. The only other comment that I'll make is in terms of that we also provided additional funding. We started phase one of the rural renewal program, and so these are multiple little projects. It's renovations. It's sometimes even just like adding doors to operating room or to surgical rooms. So small things like that, upgrades. Areas needed to be renovated. So we're doing phase two of that, and so that's going out to the whole process, and that will be funding them over the course of the year. But there's another envelope of that to be able to address some of these issues across the entire province.
Justin, maybe you could send to this journalist a list of the capital maintenance and repair projects for rural hospitals.
You got it, Premier. You have a follow-up?
I do, yes. And also, just this is more of a general question, but in terms of the recruitment of physicians, especially locally here in Alberta, is there any additional work being done to help them with tuition costs and ensure that when they graduate from, say, University of Calgary or University of Alberta, that they are able to work in their local communities?
100%. In fact, I mentioned that $90 million in additional incentives for the recruitment and retention of physicians to rural areas. In addition to that, we have put out several $1 million in dedicated support for covering university costs for physicians who are committed to going and working in rural areas, and for those who come from rural areas. Because what we find is that it's kids who grew up in the country are more likely to want to go and live in the country and in the communities that they grew up in. So there can be a strong correlation. And here's part of the problem. Sometimes those brilliant young people, like the number of spaces available in our medical schools, U of A, U of C, are by nature quite limited. And so the admission standards are extremely high and competitive. And so what we have done is to work with the universities to set aside a certain number of positions to make sure that they are filled by rural Alberta youth who want to do that formation at university and then come back and serve their communities. Do you have more specs on that, Jason? Did I say something wrong?
Nope, you got it right. The only thing and we'll get you the details on it, but we announced about 3 weeks ago the Reside program. And so that actually will be, helping pay for tuition for students but then they have to actually make a commitment to go to rural Albertas. We've done a list, and we'll get you the list now of where there's a severe shortage. So this is a 3-year program that's funded, and it's funded throughout in this current budget to be able to get physicians to those areas. And that list, we can actually add more to the list. But these are like usually very, very small centers. But that's in addition to the rural retention program, all the work that we're going to be doing, particularly with AHS in terms of sponsoring new physicians coming in here. And quite frankly, we're going to be receiving a report from the committee that's actually looking at this on the rural as how effective are our current programs, and what else can we do more, because we know that this is a key issue, and quite frankly, it's one of our key areas of focus over the next year.
Thank you, Premier and Minister. We're now going to move to the phones. Operator, can you please put through our first caller?
Thank you. Lauren Boothby, Edmonton Journal.
Hi, this question's for the Premier. Thanks for taking my question. So hospitalizations from COVID-19 are dropping, but right now they're still higher than the peaks of all of the other previous waves besides this one. So are you worried at all about a repeat of the disastrous open for summer plan when you moved? You said you were too optimistic and you moved too quickly. So are you being too optimistic now, making these changes because, people want the pandemic to be over, not because it actually is?
Well, thank you for the question, Lauren. No, I think we're being realistic. We've taken a very careful and measured approach based on the data, not just here, but around the world. We've seen places like England, Ireland, Denmark, Norway, Sweden, Finland, other European countries, and U.S. states hit earlier by Omicron, who have lifted all or almost all health restrictions weeks ago. And they've, with one or two exceptions, broadly, they've continued to see a downward trend in new cases, total active cases, and hospitalizations, which would suggest that our experience in Alberta is consistent with international trends. Now, I don't have a crystal ball. We can't predict with 100% certainty what the future may bring. But what we do know historically from contagious respiratory viruses like this is that typically over time they become less severe and do move to endemic status. That obviously was the case with the Spanish flu. 1918 to 1920, it took about 50 million lives around the world, but new variants, mutations, and widespread population immunity eventually made it part of just the background of our lives. In fact, the viral descendants of the 1918 Spanish flu continue to circulate today, but we all have built up some degree of immunity, and the flu shots that many of us get are part of that. So that's what history would suggest. Now, it doesn't guarantee that we won't see a severe variant in the future, but we are in a much better position than we were in the summer to cope with that. With 90% first dose protection amongst adults and 87% second dose, with the third doses easily available, as well as the pediatric vaccines for parents who choose that for their kids, and as I say, these more effective therapies that are coming on stream. So with all of that on the population protection side, plus the knowledge that we've all gained, and the special care that people who may be immunocompromised can take, and our determination to increase health capacity, taken all together, we believe that this is a safe and prudent step. You're right that the overall number is still of hospitalizations outside of ICU still relatively high at about 1,300, but it's important to stress that now 30% of those are incidental COVID cases, people who are in hospital with but not for COVID. They're not being treated for COVID. So that is to say we're down to about 800 people hospitalized for COVID, and that number is dropping every day.
Thank you, Premier. Lauren, do you have a follow-up?
Yeah, I want to ask, first, if you can clarify why you think the transmission is down without having accurate case data, because wastewater testing isn't a replacement for that data, as according to the people who created that data set.
Yeah.
But given that, given that for like the people, businesses, cities, they're still worried about cases. They still want to have some kind of mask mandate or some kind of restrictions in their businesses. What would you say to the people who want to keep them in, and to people who maybe aren't comfortable with what's happening?
Sure. So on your first question, which is a reasonable one, because as I admitted, the daily new active case number is not as useful a leading indicator as it was 12 and 24 months ago, because Omicron was so transmissible that every place in the world has had to change their testing protocols and limit access to testing. But we have seen a consistent decline in our positivity rate. About 3-4 weeks ago, we were at 40% of PCR tests being positive, and we're now at closer to 20%. So we've halved the positivity rate. And very important, the wastewater data we collect from about 18 communities across the province continues to trend down or show stable indicators in almost every community in the province. And that you can see that data online, available at the Alberta Health website. So those are the indicators which suggest, the leading indicators that suggest to us transmission is down. And also new hospital admissions. If transmission was up, we would see that reflected about a week or 10 days later in new admissions, but new admissions continue to drop like off a cliff, which is very encouraging. So those are the leading indicators. On the second question about businesses or organizations that may want to maintain a mask mandate, well, that's their prerogative. If somebody owns a private business and they want to ask people to do that, they are welcome to. I can imagine that there are some occupations where people are working in very close quarters. Perhaps, some of the meat processing plants in the province. I fully expect that the employers will work with the unions and their workers to maintain their own protocols that they think is appropriate at their risk level. But again, this is about moving forward with confidence to localize and personalize those decisions. We don't think it's justifiable now to impose mandates on the entire society, particularly at a time when there's declining compliance, and we just don't see the need. Let me share this with you. When the schools came back for in-classroom instruction about 6-7 weeks ago, we were told, you can go back to the Twitter rage machine for Alberta ledge politics, or whatever they call it, and you will see thousands of people saying that this was a disaster, we were going to be creating, risking the lives of kids, and the schools wouldn't be able to operate. In fact, since then, we've never had more than 24 of our 2,400 schools on at-home learning. Right now, there are none. None 18 days after we lifted the mask requirement in our schools. Now, the Federation of Labor and the Teachers Association threatened to sue us to force the mask mandate on little kids indefinitely at schools because they said this would be unsafe. 18 days later, we've gone now to 0 schools at-home learning because the number of outbreaks and the volume of transmission in schools has declined markedly since the mask mandate on schools and kids was lifted. I think that's more encouraging data. And you know what? We shouldn't live in fear forever. We should take yes for an answer.
Thank you, Premier. Operator, can you please put through our next caller?
Thank you, Lauren Pullen, Global Calgary.
Hi there. Thanks for taking my question. My first question is for the Premier, just to follow up on that step 2 moving forward. You, of course, have cited the good news here in Alberta, seeing all of our COVID numbers dropping, and spoke several times about multiple places around the world that have lifted restrictions seeing success. The Danish Health Authority has reported an increase in cases and hospitalizations and they are continuing to rise after lifting restrictions. My question for you, Premier, is was this move to step 2 a direct recommendation from Dr. Henshaw? And if it was not a recommendation from our CMOH, why do you think it's safe?
I'm sorry, you said something, we have a unclear audio here, and you said that some place had lifted restrictions and cases have gone up. Could you repeat where you were talking about?
Yeah, the Danish Health Authority has reported an increase in cases and hospitalizations.
Denmark, okay. Yeah, thank you. I did mention a moment ago, I said that I listed a whole bunch of countries and jurisdictions that had lifted restrictions, and I said the general trend was cases coming down with a couple of exceptions. One of the 2 exceptions I had in mind was Denmark, and yet the very latest data, and I was briefed on this last night, shows Denmark now tracking down. Now, Denmark's data is different because they have the biggest testing regime in the world in terms of PCR. They decided to go big on PCR testing. They can pull about 150,000 tests a day. So their case rates are, in a sense, distorted because of that. Secondly, Denmark decided to drop all public health restrictions last month, several weeks ago, and they've decided to maintain that policy setting because while there have been some increase in hospitalizations, it has not been seen in intensive care and in truly severe outcomes. And they have defined that the pressure was manageable. So that I find encouraging. And the vast majority of jurisdictions that drop measures, I mean, if you don't mind my saying this, I think you're cherry-picking one counterexample to the general global trend of decline in cases and hospitalizations following the lifting of measures at the end of Omicron. That's not to get, by the way, let me say, I was asked earlier about future waves. COVID is not over. There will be future waves. The question is, will those waves pose an unacceptable pressure on the hospitals? We do not see that anywhere in the world right now. That's hopeful news that we should take some heart in. Doesn't guarantee us the future, but it's an encouraging sign that we should act on. In terms of the Chief Medical Officer's advice, the decision I've just announced to move forward to phase 2 in lifting almost all measures was part of the Path to Normal plan that we published 18 days ago. And that was based on advice that we received from the Department of Health. We always listen respectfully to the expert input and advice of the Chief Medical Officer. But at the end of the day, it's elected officials who are accountable to Albertans that have to make the final decisions and have to balance off multiple considerations. Chief medical officers and public health experts are very much focused, understandably, on one particular set of issues. But the elected decision makers have to consider a broader range of questions, including the willingness of the population to comply with measures, the broader impact on people's well-being, and ultimately, elected officials have to make judgment calls. Because I'll give you the example of kids. We decided 18 days ago to lift all measures on children and youth. And we did so because we have observed through data the disproportionate impact that children and youth have borne throughout COVID with restrictions. And we just didn't think that was morally justifiable any longer, given the much lower severity posed by Omicron and the declining pressure on our hospitals. So yes, those are judgment calls that elected leaders have to make, and we're accountable for those decisions.
Lauren, do you have a follow-up?
I do have a follow-up. It's actually for Dr. Muir. Doctor, I was just wanting to gauge your take on these next steps here. Do you think it is the right time to be moving to step 2 right now? Do you think it's safe?
You know, I apologize because I can't hear what you've just said.
Pardon me, I'm unsure what the issue is with the connection with my phone here. My question is just gauging your reaction to the move to step 2, Doctor. Do you think it is the right time to be moving to step 2, and do you think it is a safe move?
The decision to move to step 2 is a decision for government, and I stand by the Premier.
Thank you. Operator, can you please put through our next caller?
Haley Germain, 660 News.
Oh, hi there. My question is for the Premier, and I'm just wondering in relation to the cabinet shuffle, Premier. Do you believe that trying to interfere in the administration of justice is okay for a minister of the Crown so long as it's not done by the Justice Minister?
Well, in fact, the report from former Justice Kent concluded that Minister Madhu did not interfere in the administration of justice, but it did conclude that a reasonable person could have the perception of interference. And I want to quote from what I think is the critical paragraph in Madam Kent's judgment, or her report. She said that having arrived at this conclusion, I must tie it back to the issues surrounding racism that I have raised above. Being angry, wanting assurances that he, Minister Madhu, was not racially profiled are all understandable reactions, given the context of the phone call. It does not absolve the minister from responsibility, but it is an explanation that deserves recognition. My mandate is not to determine what flows from the conclusions I have drawn, but it is important to say that the context of my conclusions cannot be ignored as we collectively search for a path to ensure equality and fairness for everyone, regardless of skin color. It was clear to me in reading Madam Kent's report that Minister Madhu did not call Chief McPhee to seek a reversal on a ticket, but to raise broader issues, in particularly the issue of racial profiling. The evidence of Chief McPhee confirms this. And now I acknowledge that there is a particularly unique role of the Minister of Justice and Solicitor General. And Minister Madhu ought not to have made the call. This was not the appropriate way to raise those concerns. And that is why I asked him to take on new responsibilities. And I believe Casey will do a fantastic job as Minister of Labour and Immigration. He actually, when he first began his professional life in Canada, did so in that department. He obviously understands viscerally the challenges that newcomers go through in paving their way to economic success in Canada. So will be a powerful and effective advocate for Alberta's action plan for fairness for newcomers, and also the implementation of our reformed Alberta immigration program, the Alberta Advantage Immigration Program. So I very much look forward to his service in that capacity. As I say, it's clear from the report that he made an error in judgment in placing that call, but it's also clear he wasn't seeking a reversal of the ticket, but rather to raise issues, particularly around racial profiling. And I think this is the best way to reflect the nature of the situation.
Haley, do you have a follow-up?
No, thank you very much.
Thank you. We have time for one more. Operator, could you please put through our final caller?
Thank you. The next question is from Alex Turgew, Radio Canada.
Bonjour Monsieur Kenny, qu'est-ce qui vous fait penser que cette fois-ci vraiment c'est une bonne décision de lever la majorité des restrictions le 1er mars?
Parce que toutes les données indiquent une diminution de COVID-19, le nombre des nouveaux cas, le nombre total des cas actifs, et particulièrement la pression sur les hôpitaux. Nous voyons une diminution dans toutes ces données. Nous voyons les mêmes situations à l'échelle internationale avec les pays et les États aux États-Unis qui ont éliminé leurs restrictions de santé publique il y a plusieurs semaines. Alors, toutes les données indiquent qu'il y aura un allègement de pression sur les hôpitaux à l'avenir. Notre donnée, par exemple, de wastewater est une bonne épreuve à cet égard. Alors, nous avons pris une approche très prudente. Nous avons attendu 3 semaines depuis la première phase des ouvertures Et alors, je crois que, comme les juridictions partout au monde, nous pouvons avancer vers la vie normale avec confiance. Il faut évidemment mettre l'accent à l'avenir sur un élargissement de la capacité dans notre système de santé qui a été souligné dans le budget interne. Et il faut encourager les autres à continuer d'obtenir leur troisième dose de vaccin. Mais avec ces stratégies-là, je crois que l'Alberta, comme le reste du monde, puisse continuer vers la vie normale.
Follow-up question?
No, thank you.
Thank you, everyone. That concludes our press conference.
Merci beaucoup. Thank you very much. Boy, that was a long event.